So this week, we're going to talk about the neurodevelopmental disorders a little more, and in particular, we're going to focus on ADHD, global developmental delays, learning disorders, communication disorders, and social and speech disorders. The DSM classifies the neurodevelopmental disorders as a group of conditions with onset in the developmental period, meaning that the onset of these disorders are occurring during a time period where development is taking place, generally in early to mid-childhood. The disorders typically manifest in early development and often before the child enters school. When a child enters school, we often then begin to compare that individual with their peers and begin to recognize a variety of neurodevelopmental disorders that might be influencing how somebody is socializing, learning, and communicating. These are characterized by developmental deficits that produce impairment in personal, social, academic, and occupational functioning. So, for example, individuals who have a hard time controlling their own behavior and emotions, having a hard time socializing with peers, or having a challenging time finishing academic work. For older people who are not children, having a challenging time within their work environments. The neurodevelopmental disorders frequently co-occur, meaning they coexist. And so, for example, individuals with autism spectrum disorder often have an intellectual disability or intellectual developmental disorder. And many children with attention deficit disorder or attention deficit hyperactivity disorder have a specific learning disorder like a math or reading challenge. For some disorders, the clinical presentation includes symptoms of excess as well as deficits and delays in achieving expected milestones. For example, people with autism are diagnosed only when characteristic deficits of social communication are accompanied by excessively repetitive behaviors, restricted interest, and insistence on sameness. The intellectual disability or the intellectual developmental disorder are characterized by deficits in general mental abilities such as reasoning, problem-solving, planning, abstract thinking, judgment, academic learning, and learning from experience. So this means that individuals have a hard time making decisions, solving problems of daily living, are certainly challenged to plan ahead for social, recreation, or vacational purposes, or just purposes of every day, thinking abstractly about items that are not concrete in here now, but might be ideas and concepts, and having poor judgment and having challenge with learning and academic functioning. So these deficits in general mental abilities then lead to deficits and impairments in adaptive functioning, such that individuals with intellectual disabilities can often fail to meet standards of personal independence and social responsibility in one or more aspects of daily life, such as their home life, their work life, their relationship with peers, communication, social participation, academic or occupational functioning, and personal independence at home or in community settings. A really important aspect of the DSM-5, which is an issue of the Diagnostic Statistical Manual that came out about 3 years ago, is that it replaces the term mental retardation with intellectual disability. And research journals also are now very much consistently using the term intellectual disability. And moreover, in the United States, in terms of public law, Rose's Law, it's illegal to use the term mental retardation, and thus intellectual disability is the term in common use by medical, educational, and other professionals and lay public people and advocacy groups. However, you may from time to time see journal articles that are older or publications that are older that still use the term, and often it is these older versions that still carry the connotations that have shifted to a more respectful, inclusive use of a term like developmental disability rather than the concept of a retardation. When exploring the neurodevelopmental disorders, the DSM specifies current severity and making a distinction between mild, moderate, severe, and profound. So when looking, for example, at autism or looking at the intellectual disability, one would be able to classify an individual with a mild, moderate, severe, or profound disability or neurobiological developmental disorder. The global developmental delay is diagnosed when an individual fails to meet expected developmental milestones in several areas of intellectual functioning. The diagnosis is used for individuals who are unable to undergo a systematic assessments of intellectual functioning, including children who might be too young to participate in standardized testing or are unable to even meet the milestones of particular testing strategies. Intellectual disability may result from an acquired insult during a developmental period. It could be, for an example, a severe head injury, or in which case a neurocognitive developmental disorder may be diagnosed. In terms of the communication disorders, these include language disorders, speech, sound disorders, and social pragmatic communication disorders, and childhood onset fluency disorder, which is stuttering. The first three disorders are characterized by deficits in the development and use of language, speech, and social communication. A social pragmatic communication disorder is characterized by the primary difficulty with pragmatics, or the social use of language in communication, as manifested by deficits in understanding and following social rules or verbal and nonverbal communication in what we call a naturalistic context, where people are in their life space. Changing language according to the needs of the listener or situation, and following rules for conversations and storytelling. So you would think that these deficits are autism, but in fact, these deficits of social pragmatic and social communication are not accompanied by a ritualistic or repetitive behavior. They're just a focus of social pragmatic communication. And so we separate them from autism, and there are children and youth who don't demonstrate that sort of repetitive, restrictive patterns of behavior, but who do have difficulty with the pragmatics of conversation, understanding somebody else's perspective, taking perspective, recognizing feelings in other individuals through facial expressions and body language, don't understand idioms or sayings, and don't connect metaphor. And these are deficits in communication that result in functional limitations to effective communication. In our social participation, in the development of our social relationships, and in academic achievement or occupational performance, communication and social pragmatic communication is really important to our success in our interpersonal relationships, and individuals with social pragmatic communication disorders are certainly struggling because of their inability to understand cues and rules and nonverbal and verbal communication and the needs of others, and put that all together. And so that's important in terms of a distinction in terms of what autism is, which is a layer on of social pragmatic communication challenges with repetitive and distinctive ritualistic behavior. And again, in order to better understand social pragmatic communication disorders, we have to learn that these deficits in social pragmatics are not better explained by low abilities in the domains of structural or cognitive abilities. So what we see there is, so it's not an autism spectrum, or it's not a cognitive developmental issue where somebody doesn't understand a word or doesn't understand language or doesn't have the ability to understand and make meaning from social communication. These children or youth that would be diagnosed with a social pragmatic communication disorder would understand language but have a hard time with the nuances of the pragmatics of it all. The childhood onset fluency disorder is characterized by disturbances of normal fluency and motor production of speech, including repetitive sounds or syllables, prolongation of consonants or vowel sounds, broken words, blocking, or words produced with an excess of physical tension. And like other neurodevelopmental disorders, communication disorders begin early in life and may produce lifelong functional impairments. Childhood onset fluency disorder can have an impact on an individual's academic functioning, social functioning, communication skills, or deficits in these communication skills create a lot of other psychological and mental health issues that are coexistent with individuals who work through life without getting support for these lifelong impairments. The autism spectrum disorders are part of the neurobiological disorders. Or neurodevelopmental disorders. We talked about them last week. They are characterized by persistent deficits in social communication and in social interaction across multiple contexts, but also includes social reciprocity, nonverbal communicative behaviors, and social interactions. In addition to these social communication deficits, the diagnosis of autism spectrum disorder requires the presence of restricted repetitive patterns of behavior, interest, or activities. And because symptoms change with development and may be masked by some compensatory mechanisms, the diagnostic criteria may be met based on historical information, although the current presentation must cause significant impairment for somebody to be considered as having an autism spectrum disorder. Within the diagnosis of the autism spectrum disorder, there are certainly individual characteristics, as noted through the use of specifiers. These specifiers provide clinicians with an opportunity to individualize diagnosis for and communicate a richer clinical description of some people with individuals with autism. So, for example, many individuals previously diagnosed as Asperger disorder will now receive the diagnosis of autism spectrum disorder without language or intellectual impairment, and we may even add on severity. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder defined by impairment in levels of attention, disorganization, and or hyperactivity and impulsivity. Inattention and or disorganization entail inability to stay on task, seeming not to listen, and losing materials at levels that are inconsistent with age or developmental level. Hyperactivity, impulsivity entails overactivity, such as fidgeting, inability to stay seated, intruding into other people's activities, and ability to wait, symptoms that are excessive for age and again for developmental level. In childhood, ADHD frequently overlaps with disorders that are often considered to be externalizing disorders, such as oppositional defiant disorders and conduct disorders. ADHD often persists into adulthood with resultant impairments of social, academic, and occupational functioning. The neurodevelopmental motor disorders include developmental coordination disorder, stereotypic movement disorder, and tic disorders. Developmental coordination disorder is characterized by deficits in the acquisition and execution of coordinated motor skills and is manifested by clumsiness and slowness or inaccuracy of performance of motor skills that cause interference with activities of daily living. Stereotypic movement disorders is diagnosed when a individual has a repetitive, seemingly driven, apparently purposeless motor behavior such as hand flapping, body rocking, head banging, self-biting, or hitting. The movements interfere with social, academic, and other activities. If these behavior cause injury, this should be specified as part of the diagnostic description. Tic disorders are characterized by presence of motor or vocal tics, which are sudden, rapid, recurrent, non-rhythmic, stereotyped motor movements and or vocalizations. The duration, presumed etiology, and clinical presentation define the specific tic disorder if it's diagnosed. And Tourette disorder, which is persistent chronic motor or vocal tic disorder, is really a provisional tic disorder and other specified tic disorder, and then there is a unspecified tic disorder. Tourette's disorder is diagnosed when the individual has multiple motor and vocal tics that have been present for at least 1 year and that have a waxing and waning symptom course. The specific learning disorder is diagnosed when there are specific deficits in an individual's ability to perceive or process information efficiently or accurately. This neurodevelopmental disorder first manifests during the years of formal schooling, and when it's characterized by persistent and impairing difficulties with learning foundational academic skills, and in particular the focus is reading, writing, and math arithmetic. The individual's performance is affected. Academic skills is well below the average for age, or acceptable performance levels are achieved only with extraordinary effort. Specific learning disorders may occur in individuals identified as intellectually gifted and manifested only when the learning demands or assessment procedures, like, for example, timed tests, poses barriers that cannot be overcome by innate intelligence and compensatory strategies. So for all individuals, specific learning disorders can produce lifelong impairment in activities dependent on the skill, including occupational performance. Specific learning difficulties in reading, in writing, and math certainly can cause challenges in a variety of areas of one's life. And then, of course, the comorbid or coexisting conditions that can occur for people who struggle with independent skills or are dependent on others to help understand reading, math, and writing can cause difficulties with anxiety and depression, and certainly can exacerbate specific learning disorders as well. In short, the neurodevelopmental disorders are certainly the most common of all of the disorders for children and youth. And in combination are a group of disorders that require care and attention by caring practitioners to be able to provide the support needed for individuals to be successful in their social, academic, and or occupational functioning. The causes for these neurobiological disorders are no different than the causes for all of our other disorders. These disorders can be caused by biological functions of the brain, can be caused by brain damage or brain injury, can be caused by an imbalance of neurochemicals, and or are exacerbated by both genetic predisposition and social experience. So, for example, somebody with a communication disorder or speech fluency disorder might over time become more anxious to speak in public because of social experiences of others making fun of that individual, or the internal pressures of feeling the pressure of speaking when words aren't coming out. So again, all of our neurobiological or neurodevelopmental disorders, if we look at from a integrative approach, really consist of a biological, a genetic or predisposition, and or a social concept of some kind of conditioning that took place as well.